Bismillahirrahmanirrahim. I'm Muhammad Sadul Islam Sharkar, again in front of you with an important topic that I have discussed in my last video, that is convalescent plasma therapy. Today I will try to discuss about this convalescent plasma therapy, and will try to make this convalescent plasma therapy more clear. Though we all know about this plasma therapy or convalescent plasma therapy, but repeated talking, repeated conversation will make it more clear, and it will keep this convalescent plasma therapy within our brain in a fixed manner. So today I will discuss how does convalescent plasma therapy work, how convalescent plasma therapy works, and how convalescent plasma therapy keeps us healthy. That is, how does convalescent plasma therapy keep us healthy? And lastly, I will try to find out the answers of a question, that is there any risk with this convalescent plasma therapy, or is there any risk involved with this therapy? So one by one I will try to find the answers of all those questions. Because convalescent plasma therapy is confusing with people. What part will be used from the blood, or what part will be returned back to the patient's body? So it should be very clear. To make this more clear, I'm just in front of you, nothing more than this. So first of all, how does convalescent plasma therapy work? We know convalescent plasma therapy uses antibodies. These antibodies are developed and produced, in a patient when or while he or she is infected by the novel coronavirus, or any or infected by any infectious disease. It's a normal procedure that will be produced within a patient to defend the pathogen, to defend the foreign bodies. That is, convalescent plasma therapy uses antibodies developed within an infected person while he or she is infected by the novel coronavirus. In this case, novel coronavirus. These antibodies are normally developed. These antibodies are normally produced in patient's body as part of the normal immune response, as normal immune response to the pathogen. And in this case, the pathogen is the novel coronavirus that is caused COVID-19 disease, that is called novel coronavirus disease 2019. These antibodies are highly specific, to invade this pathogen. These antibodies are highly specific to attack, to hunt the novel coronavirus within the patient, and so work to remove or to eliminate these novel coronavirus from the patient's body. Once recovered from the novel coronavirus disease, uh, uh, somebody or who is recovered from novel coronavirus disease, once recovered, he can give or he can donate uh, his blood, and from this blood, plasma can be collected to treat the second patient, to treat the other patients. The donated blood is then checked for the presence of any other disease causing agents, for example hepatitis B, for example hepatitis C, for example HIV. If deemed safe, if considered safe, or if thought the blood, collected blood or donated blood is safe, then this blood is taken through a process to extract antibodies to extract plasma from this blood, and once extracted, this plasma, which is rich in antibodies. I mean, the antibody rich plasma is then injected to the second patient, to other patient, to protect the novel coronavirus under some medical conditions. That is, once a patient is recovered from novel coronavirus, that is, once recovered from the novel coronavirus disease, he can donate blood, and this blood will be taken under some process to extract plasma, which will contain antibodies, and these antibodies rich plasma will be injected to second patient for the treatment of this COVID-19 disease, and this antibody rich plasma will act to eliminate the novel coronavirus from the second patient, to defend this novel coronavirus within the second patient. And this process will be done by some medical condition, under some medical treatment. It's a typical matter actually. It is a tough, it is a difficult and complicated job for the doctors to do this convalescent plasma therapy from one patient to another. Some immunologists, especially Arturo Casadrel, he's one of the prominent immunologists at John Hopkins universities. He said the concept is simple. He's saying the convalescent plasma therapy concept is very simple. Patients, he's saying, patients who recover from an infectious disease, normally his body or his immune system can produce some antibodies against this infectious disease that will protect him against later infection with the same microbe, and this immunity can be transferred by giving serum, by giving this plasma from a patient to other who is at risk of infection. That is, Arturo Casadrel at John Hopkins University, he is a renowned immunologist. He is saying when a patient or when a people is suffering from an infectious disease, his body will normally produce some antibody against that causing agent, against this infectious pathogen, and this antibody will protect himself against later infection, against after infection with the same microbe. And this immunity, that is this antibody, he's saying this antibody can be transferred, can be shifted by giving serum, by giving plasma, who are at risk of this same infection. And these Arturo Casadrel, along with some other renowned immunologists at John Hopkins universities, stated for effective therapy, stated some statements about effective convalescent plasma therapy. That is, they are saying a sufficient amount of antibody should be administered. Plasma that is administered in the second patient should contain a sufficient amount of antibody. When given this plasma to a susceptible person, to a susceptible patient, normally this plasma or this antibody will circulate throughout the whole body by the blood of the second patient, and these antibody will reach to the tissue, these antibody will reach to the cell and provide a protection against infection. That is, they are saying a sufficient amount of antibody should be administered when given to a susceptible person, when given to a susceptible patient. This antibody will circulate through the blood and will reach to the tissue and will reach to the cell of the second patient, and will provide a protection, or will provide a protection against infection. And they are also saying, depending on the antibody amount, depending on the composition of the antibody having in plasma, will provide a protection. The protection that will be conferred, that will be offered, that will be recommended depends on the amount of immunoglobulin, that is antibody, and these will take place, these will last for weeks to months. That is, Arturo Casadrel, along with renowned immunologist, are saying that depending on the amount of the antibody, depending on the composition of the antibody having in plasma, the protection conferred, the protection offered by those transferred immunoglobulin, transferred by the antibody, can last for weeks to months within the second patient. That is, these immunoglobulin, that means antibody, immunoglobulin, it means it's a class of proteins that will be present in the serum and cells of the patient in his immune system, that will act as an antibody. Immunoglobulin, simply it's an antibody. It will be present in the serum, it will be present in the cells of the immune system of the patient, and it will act as a simply antibody in the patient's body. So, and this immunoglobulin or this antibody injected or ingested to the second patient will last for weeks to months, and it will work against infection. It will work to protect the infection to the second patient for long weeks to month. These are the ways of working pattern. These are the ways how convalescent plasma will work in the patient's body. So now I would like to say, how does plasma keeps us healthy? How does plasma keep us fit to fight against the novel coronavirus? Actually, plasma arrangement and plasma management is a critical job, is a critical part of the treatment, especially for some serious health problems, especially for some serious health sickness, and that is why people are asking to donate plasma, and plasma arrangement is very typical because people are not willing to donate plasma. People are not willing to donate blood just after the recovery of the COVID-19. It's very typical to arrange plasma. It is very difficult to manage plasma, and in case of management of the plasma, that is, there are some ways. In my first video, I have said that these plasma will be automatically separated from the patient's blood, and the blood or the rest of the blood will be circulated back, will return to the patient's body, and plasma will be automatically separated through a machine. I have said it in my first video. Out of these, there are some other process. After collecting blood from the first patient, uh, then plasma will be separated from this blood. This is another way. And some other ways for to collect plasma, that is, uh, blood normally along with plasma along I'm just going to say about plasma along with blood cells, along with water, salt, and enzymes. Plasma also contains some important components that is defined as vital parts of the blood. So these plasma, after screening, after separation of this plasma from the blood, uh, these vital part having in plasma, that is antibody or any other proteins, for example uh, uh, proteins including albumins and fibrinogen, that is the important part, other than water, other than salts, other than enzyme and blood cells. This plasma also contains some important and vital matters, vital components, including clotting factors, including antibodies, and some proteins that I have said, albumin and fibrinogen. These vital parts are then separated by some healthcare workers, and these vital products or vital parts will be concentrated in various products, and these products is then used as a treatment, and these vital products can help save the lives of people from various diseases, for example burns, for example shocks, for example trauma, and for example some other medical emergencies, including surge, COP2, I mean COVID-19. So these vital products can then be used for the treatment of these diseases. So uh, uh, management and arrangement of plasma is very difficult. Plasma will be separated from the blood automatically by some machine, or plasma will be separated after collecting blood, and after separation of the plasma, some vital products having in plasma, especially antibody, clotting factors, proteins, including albumins and fibrinogen, that vital components will be again separated and concentrated into various products. So this is a very typical way. You can just directly inject the plasma to the patients, or you can inject antibodies after concentrating these antibodies into various products. So I don't know what process are doing right now. Well, probably plasma is injecting directly, not only the antibody from the plasma through some products. So most probably plasma is directly injected to the patients in some countries or in my countries. So important matter is these proteins and antibodies that are found in plasma can be used in therapies, for example some rare chronic conditions. These rare chronic conditions means autoimmune disorder, that is immune system disorder in case of COVID-19 patients, and in case of hemophilia, that is the patients who are suffering from hemophilia, that is lack of coagulation factor in the blood or inability of the blood to clot, that is called hemophilia. In this, in case of hemophilia, in case of COVID-19, these antibody can be used, and the people who are suffering with this rare chronic condition can live long, can live a productive lives because of the treatment through this antibody or through these vital products, the treatment by these vital products. And some health organizations are saying that plasma as the gift of life. So this is all about the activity of the plasma, by which it can keep us healthy, or it can keep us fit. Now I would like to say about the risk factor. Is there any risk involved with this plasma therapy? It's a very important thing. Don't be demotivated. I'm just saying to be alert, to be cautious about this therapy, to know about this therapy. And this is not my statement. I'm not saying this is from my own self. This is from some renowned immunologist at Johns Hopkins University. That is, besides speaking the success of the convalescent plasma therapy, a study is conducted by some renowned immunologist at Johns Hopkins Universities, stated that they have stated that there are some risk involved with this plasma therapy. So we should know this risk also for our betterment, for our cautions. That is, there is a possibility to be transfer some blood substances from the first patient to the second one, or from the first patient to the other patients. That is, simply we know blood is transmitted as blood transfusions are taking place. Blood transfusion is taking place. Some inadvertent infection, that is called some unintended infection, that is, if I say very clearly, some unintentional infection, some unexpected, some unwanted infection might get transferred from the patient to the other patient through this blood transfusion, or through this plasma transfusion from one patient to another. This is not only for this plasma therapy, this is also for the transfusion of blood from one patient to another. There is a risk. And another risk is there is a possibility to enhance the infection rather than the recovery. That is, these plasma therapy might fail in some patients and can result an enhanced form of infection. That is, this plasma therapy will not be successful in case of 100% patient. In some patients, this plasma therapy might fail and can result an enhanced form of infection. This is also a risk. And another risk stated by the renowned immunologist from Johns Hopkins University is that they are saying effect on immune system. That is, there might have a possibility after the ingestion after injected of plasma from the first patient to the second one, these plasma therapy may end up suppressing the immune system, natural immune system in the second patient, leaving the COVID-19 patient vulnerable to subsequent reinfection, leaving COVID-19 patient attackable to regressive reinfection, leaving COVID-19 patient vulnerable to following reinfection. That is, they have tried to say these convalescent plasma therapy, when ingested to the second patient, it might end up suppressing the natural immune system of the patient and leaving this COVID-19 patient so vulnerable to subsequent reinfection. So we should know about these convalescent plasma therapy in a good manner. That is, we should know this plasma therapy in a good way. We should share the latest facts, latest news, and latest information about plasma therapy, and we should know about the update information. We should know about up-to-date reports and announcement of plasma therapy, and we need to avoid hyperbole or hyperbolic speech, hyperbolic language, exaggerated language about this plasma therapy, because it's not an easy process, it's not a matter of joke. So and we should adopt a practical and pragmatic use of plasma therapy. We should adopt effective and efficient application of plasma therapy. We should adopt tested and feasible doses of plasma, and we should adopt applied and functional use of plasma therapy in order to stay safe, in order to stay protected. So no more today, more when we meet again. Allah Hafiz.